Dr. Jeffrey D. Klausner. He's a professor of public health at the University of California in Los Angeles. Welcome to the program. Let's talk about the numbers before in the US, before we talk about California specifically. It took the United States nearly 100 days to get to 1 million cases, and now just 5 days to get to another million. How is that possible?
Well, we're on a serious increase right now in California, and particularly Southern California. We've seen a rise in number of new cases. We've seen a rise in cases of hospitalizations, and unfortunately, a rise in number of cases of deaths as well. The virus is easily spread in crowded conditions, particularly indoors. And when people gather with family members and when people gather with, friends and colleagues and contacts, particularly inside, that's where we see the majority of transmission.
And California's lockdown in March was seen as a model for the US at the beginning of the pandemic. Why did that change?
Well, I think in March, when we saw a tremendous increase, particularly in New York City and New Jersey and Connecticut, we're able to flatten the curve in Southern California and in the Bay Area. And then things opened up in the spring and the summer here in California. And now with cooler weather and people spending more time indoors, we start to see an increase in spread. So at some level, this was expected. In the fall, in November and December, we would see an increase of cases. And what we need to do is try to balance our efforts to reduce the spread of transmission and reduce the effects on the vulnerable. In California, about 70% of all deaths have occurred in those over 75 and 80% of those over 65. So we know who the most vulnerable are, and we really need to focus on protecting the elderly.
And do you think the measures that are being proposed are enough to protect the elderly and the most vulnerable?
Well, we've seen when we have regular testing in nursing homes, in assisted living care facilities, that regular testing of residents and staff actually has a substantial effect at reducing the spread of infection in long-term care facilities and nursing homes. We still need more testing. We need more testing, particularly in California in Latino populations and among essential workers. So people who have to go to work, who have to leave their home, we need to make sure they can be tested on an ongoing regular basis.
Dr. Jeffrey D. Klausner speaking to us from the University of California in Los Angeles. Thank you so much. We appreciate your time.